Okay, hi and welcome to Synapse. This is Dr. Sonika. In today's short video, we're going to look at the differences between keloid and hypertrophic scar. This happens to be a stock question both in prof exams and also for the entrance exams. So let us look into the differences. So the first one is regarding the genetics. The race. Blacks are more prone to have keloids than the Caucasians, but there is no such predilection in hypertrophic scar. So next, coming to genetics, there is genetic predisposition that we see in keloids than hypertrophic scar. Hypertrophic scar is not associated with any genetic component. Coming to age, keloid is common between 10 to 30 years of age. This is because this is the age where the collagen production is higher. We will see in the pathology part that the pathology in the scar formation and there's abnormal ways how the scar heals or forms is because of increased collagen production, and 10 to 30 years happens to be the age where the collagen production is more, and hence keloids are common in this age, but hypertrophic scar can occur in any age. Coming to the sex part, keloids are common in more in females, and that too they happen to be more common during the puberty and pregnancy periods, and hypertrophic scars are common in both men and women. So now thinking about the insult which will cause these scars, keloid, usually the insult is minor and there won't be significant injury as such. It's because the patient has the tendency to form keloid that the keloid is formed. And hypertrophic scar will be associated with a significant trauma or incisions that we may take surgically and burns. So there will be some amount of significant history that is involved with hypertrophic scar. You can imagine like having a very bad fall during a childhood. We might still be having hypertrophic scar on our legs or our hands. So that is a typical example of a hypertrophic scar. And coming to location, keloid has typical location of anterior chest, occurring on the anterior chest. It can be on the shoulders and in the upper arm as well. And hypertrophic scars can occur wherever there is significant injury, as we have just mentioned, but common being the neck, knees, ankles, and the shoulders, where we tend to have a common place for our day-to-day injuries. Next is the borders. So keloids, they outgrow the margin. So if this is the scar margin, so the keloid will tend to outgrow this. It will be beyond the margin of the scar, but hypertrophic scar will remain within the margin. This is a very, very important clinical point that is going to help us differentiate the conditions in the OPD. Coming to the natural history, keloids occur months after injury. It's not necessary that it should appear within so many days or months or weeks after the injury. But hypertrophic scar usually occurs within 8 weeks of period, grows till 6 months, and then we see that it will regress. So that is a natural history of the two conditions. And other complaints such as associated pruritus history will be quite significant in keloids. It may be present in hypertrophic scar, but it is not very significant. And coming to regression is pretty rare in keloids, but it occurs with time in hypertrophic scar. Coming to histology of keloids, I just mentioned that the problem here is increased collagen production, and this collagen is in disorganized manner. It is not in a proper organized fashion. Okay, and the next important thing is the quantity of the myofibroblast. The myofibroblast content is decreased. In hypertrophic scar, the collagen component is, as compared to normal tissue, is increased, but with respect to keloid it is reduced and myofibroblast content will be higher. That is why they do not go beyond the scar. It's because the myofibroblast contract and they keep the margin within the borders of the scar. Next, biochemical, as we have mentioned, the collagen is more. So in keloid the production is up to 15 to 20 times normal, but in hypertrophic scar it is 4 to 7 times the normal. So in both the cases collagen production is increased, but way more increase in keloid than in hypertrophic scar. And TGF beta, the tissue growth factor beta, is increased in both, again because the collagen production is increased in both. So these are the standard differences, important differences, 12 differences that we have seen between keloid and hypertrophic scar. So I hope this helps you revise before your exams. Thank you.